Hi, my name's Megan, and I'm going to be doing my corrective exercise continuum video on Achilles tendonitis. Achilles tendonitis is a possible strain or tear to the tendon, and it's due to overuse, and it can be really common in runners. The Achilles tendon originates at the gastrocnemius on the back of the calf and attaches to the calcaneus at the heel. Its action is to assist the gastroc in plantar flexion. In this video, I'm going to be doing a manual assessment, a movement assessment, corrective exercises, and then to determine if those corrective exercises were successful, I'm going to perform the movement assessment again to see if we've got any extra range of motion. So first, for the manual assessment, I'm just going to be palpating the calf of the patient, and I'm going to be looking for any sort of discoloration or muscular tension between the injured side and the non-injured side. Differences in temperature and pain and swelling will also show that there is a tear or strain to the tendon. And then next, I'm just going to take both of my thumbs on the outsides of the tendon and just rub downward very lightly against the Achilles tendon. And I'm again looking for pain, swelling, tenderness, and even the presence of lumps. Any of these problems can show that there is a tear or strain to the tendon. Lastly, I'm going to be doing a Thompson test. So I'm just going to lightly squeeze the outside or the gastroc. And when I do this, the foot should just barely move into plantar flexion. If it doesn't, this could also be a sign of a possible tear or strain to the ligament or the tendon. Okay, flip over, please. Sit up. Thank you. And for the movement assessment, I'm just going to put the palm of my hand against the ball of the patient's foot and lightly push his foot back into dorsiflexion. And we're just trying to see how much range of motion we can get and how much flexibility he has in his gastroc and in his Achilles tendon. Next, I'm going to have the patient push his foot against me, and we're trying to test his strength in his gastrocnemius and how well the Achilles actually assists in plantar flexion. For the corrective exercises, we are first going to start out with an inhibitory technique to decrease neuromuscular activity. Inhibitory techniques are self-myofascial release exercises. We are going to first start out with foam rolling the gastrocnemius, which is on the posterior side of the lower leg. Tight gastrocs can lead to injury of the Achilles tendon due to the origin of the Achilles tendon being at the gastrocnemius. The patient, if he wants added pressure to his calf that he's foam rolling, can put his left leg over his right shin. Foam rolling should be done for no longer than 45 seconds to 2 minutes. Next, the patient is going to foam roll out his anterior tibialis, which is on the lateral side of the tibia. He's going to get into a plank position and then tuck his leg under into a pigeon stretch in order to reach the lateral side of the tibia. Lastly, the patient will foam roll out the bottom of his foot using a tennis ball. We'll be rolling out muscles such as the flexor digitorum gradus. The reason we are rolling out the gastrocnemius, the anterior tibialis, and muscles on the bottom of the foot are to temporarily loosen the muscles surrounding the joint. Next, we're going to do a lengthening exercise to increase extensibility. The patient is going to put the towel around the ball of his feet and pull his toes toward him into dorsiflexion. We're temporarily lengthening the tendon and the gastrocnemius to get more range of motion at the joint through manual assistance. Next, we're going to use an activation technique to re-educate underactive tissues using positional isometrics. First, the patient will wrap the red band around the top of his foot, and he's going to pull his toes in toward himself using his anterior tibialis. For the other portion of this activation technique, the patient is going to wrap the band around the ball of his foot and point his toe downward to the floor in plantar flexion. This is going to strengthen the gastrocnemius, and the Achilles tendon is going to get movement because it assists in plantar flexion. Lastly, we are going to do an integrative technique to retrain synergistic function using dynamic movements. The patient is going to perform a single leg deficit calf raise. Through this movement, he is strengthening muscles surrounding the joint, such as the gastrocnemius, which is the agonist in this movement, the soleus, which is the synergist, and the anterior tibialis, which is the antagonist. Integrative movements prevent further injury and increase proprioception. Lastly, to determine if our corrective exercises were actually successful, we're going to re-perform the movement assessment. So again, I'm going to place the palm of my hand on the ball of the patient's foot and push back into dorsiflexion to see if we got any added range of motion in the flexibility of his gastrocnemius and his Achilles tendon. The range of motion for dorsiflexion should be 0 to 20 degrees. And then to finish the movement assessment, we're going to test his strength of his gastrocnemius and the Achilles tendon, which assists in plantar flexion. He's going to push through the ball of his feet into my palm, into plantar flexion. And that concludes my video for the corrective exercises on Achilles tendonitis. Thank you for watching. Next, I'm going to perform a movement assessment. I'm going to put my foot at the bottom of the patient's foot. Put my foot at the bottom of the patient's foot. What do I say?
I wasn't going to say.
For the lengthening aspect of the corrective exercise continuum, we're going to have the patient put a towel around the ball of his feet, but god damn it. Lastly, for the integrative technique, which is a dynamic movement assessment, not assessment, you stupid fuck.